chest pain. It's so scary, and anxiety. Combine both of them and you get an experience you wouldn't wish on your worst enemies. Most of us feel certain that we're dying. That the chest pain is a sign that you are going through a heart attack. That you anxiety disorder of really killing you.Now. But before you panic any further, take a deep breath. Here's how to know if your chest pain is caused by anxiety, and how to stop it in less than a minute. Okay, let's go. Can anxiety cause severe chest pain? You may be relieved to find that the answer is yes. Chest pain is one of the common symptoms of anxiety and panic, along with rapid heartbeat, sweating, nausea and dizziness. How does anxiety chest pain happen? People having an anxiety or panic attacks are prone to hyperventilation, breathing in too much oxygen. This contracts blood vessels and causes considerable chest pain. General anxiety disorder is usually accompanied with poorer digestion and bloating. Bloating can increase the pressure on the lungs and lead to chest pain. Your biggest problem is, heart problems can feel exactly the same as an anxiety attack. So how do you know? How to know it's probably not a heart attack. Anxiety-induced chest is usually located over the heart and described as sharp pain. The pain usually increases when you breathe, but it doesn't tend to continue more than a few minutes. If you apply pressure to the area, the pain gets worse. That is a major difference from heart-related chest pain. It is usually accompanied with palpitations, shortness of breath, dizziness and tingling in hands and feet. When an anxiety attack begins, the body feels that it's in a state of danger and produces adrenaline. Adrenaline gives you a boost of energy that you are supposed to use for escaping the danger. It speeds the heart rate and causes muscles to contract. That causes the chest pain. It can also be caused by the release of stomach acids and indigestion. Chest pain and anxiety are really good friends, so I can tell you right now that this chest pain is probably not a heart problem, but you still have to get checked by a doctor. Dozens of people I know rushed over to the hospital convinced that they are having a heart attack, but it turned out to be only an anxiety attack. How to stop anxiety-induced chest pain? The symptoms of anxiety attack will respond to anxiety control techniques, like deep breathing and relaxation exercises. Here is one powerful technique to immediately stop chest pain. It is best done sitting but can also be done standing or lying down. 1. Sit with your back straight and your hands in your lap or on your thighs. Close your eyes. While doing this, keep the tip of your tongue touching the top of your mouth. When you inhale, do it through your nose. Exhale through your mouth. Ready? 2. Start inhaling slowly for 4 seconds, count them in your head, not out loud. Push out your stomach and fill your lower lungs first like that. Then the rest of the lungs are filled. Hold your breath for until you count to 7. Exhale comfortably for 8 seconds. Try to imagine that all the anxiety is leaving your body while you are exhaling. You are letting it go. Pause for 2 seconds without inhaling, very important, and do this one more time. Repeat until you feel your chest pain gone. And it will be. Warning: this technique won't prevent your next attack. While this technique will bring you excellent temporary relief, you may want to consider switching from anxiety management to anxiety cure. You don't have to manage, control or deal with anxiety and panic attacks. There are ways to cure this condition, without medication. Who wants to depend on those for life?